Hi, I'm Dr. Natalie Marks, and welcome to a special edition of Quick Cup of Knowledge. Joining me today is Dr. Jason Stull. Dr. Stull is an assistant professor at The Ohio State University and the University of Prince Edward Island. He's a veterinarian with very unique and expert knowledge in the area of epidemiology, public health, and infectious disease. Dr. Stull, thanks so much for joining us today.
My pleasure.
We were just half joking, half not, saying, for an epidemiologist right now, this is either sort of your biggest dream, right, to study, or worst nightmare. What is the outlook and kind of the reaction amongst the epidemiologists in the veterinary community right now?
So I think it's a tough one. I mean, I think as veterinary epidemiologists, we certainly are aware of the science behind a lot of this. But, and that's, of course, interesting, and there are many ways that we can play a role in that. But I think at the same time, there's obviously this cultural component to it. And as we watch it change all of our lives, it becomes extremely personal. So we have this kind of academic piece on one side, and we also have this very, very personal part that it's hard to kind of disentangle those two components.
It is. So let's try today to give some accurate knowledge to veterinarians and their teams about coronaviruses in general and about COVID-19 and how we can be educating our clients appropriately, as well as what veterinarians should really take from this pandemic. So kind of back to basics, what are the coronaviruses that we typically deal with in dogs and cats in small animal practice?
Sure. So first of all, coronaviruses, there's 4 different, genera of coronaviruses that are potentially of interest for public health or even veterinary health. So one of those genera includes many that we deal with. So for instance, canine coronavirus, respiratory or enteric. We certainly talk a lot in vet med about FIP, feline infectious peritonitis. So these are ones that we frequently deal with, we're very comfortable with, and I think we are educating clients and ourselves on these all the time.
And I know there's a lot of talk, because we do see coronaviruses, of perhaps some misinformation about a dog and cat's role right now with COVID-19. So one of the things that came out in the popular press was this weak positive in a canine in Hong Kong. Can you clarify a little bit more about the details of that positive? And do we know, or do we maybe not know, what the role of transmission is for dogs and cats in this?
Yeah, this is a tough one. So for instance, so that as you were alluding to, there's a dog that was in Hong Kong. It was owned by an individual who did come down with COVID-19, so coronavirus infectious disease. And the dog was fine, dog was healthy, but as precautions, they put the dog into quarantine and they ran testing on the dog. So they used a PCR test, so a very, very sensitive test. And they did find pieces of virus. So it was positive, in other words, for the virus based on the nasal and oral swabs that they took. They did that several times over several days between each test, and they continued to be positive. What does that mean? It means that there was, at least at some point, virus that's present in the oral cavity of this dog. Many people are saying, well, that could certainly suggest that the dog was infected. Okay. They've done serology on the dog. So this continues to be, again, we're talking about one dog. And so there's a lot of kind of questions as to what this means overall. But it does raise into question, is it possible that our companion animals could potentially be infected? The more important question possibly, so is certainly that we don't see animals getting sick from this disease right now. So that's great news. But then the other question is could animals potentially spread the disease? And that's one, of course, that's important. And so right now, we just don't know a lot about it. I think the most important thing is that at this point in time, as people say, there's no evidence to support that pets can be infectious with this disease, or that are spreading this disease. Now, lack of evidence doesn't always necessarily mean it doesn't occur. It just means that right now that's not our primary concern in public health. The other issue that kind of comes up a lot is also, is it possible that animals could get this virus on their fur and then could potentially transmit that virus to other people, for instance? And this is a real concern. This is one that we really, again, don't have a lot of information about. And so We need to, as veterinarians that are kind of practicing and seeing these pets, we need to be cautious about these various aspects and decide for ourselves and based on kind of what's happening in our own world, because this virus is very different across different areas in the sense that, you know, what's happening in terms of an epidemic in one region may be very, very different in another, and the responses that are going to be happening will also be different, right? So an area that's, you know, just beginning to start to see cases is going to be responding potentially different than an area where there's a lot of human cases. And so as veterinarians, as people that are working in the animal industry, I think these are questions that we have, and we don't always have all the answers.
So it sounds like using just caution, as you would in any of these outbreaks. Like when we were dealing with canine influenza, there was changing information every day. So we need to obviously be alert and be using all the good hygiene and safety precautions as we would have been anyway, we hope, right?
We know that that infection control is key. And as part of that, all the things that we can do, even though we're not seeing, for instance, animals likely serving as an important role in transmission to people, all of us in veterinary medicine are very involved in dealing with the public, whether that's individuals coming into our clinics, whether that's communicating with them, trying to help the concerned well. So that I think reinforces our role in recognizing the importance of general concepts around infection control, but also our roles as educators for the public.
And I'm glad you said that, because you and I are both huge proponents of the One Health initiative. And this is, I think, at any time in the world, this is so important to understand our role as public health officers in keeping our pets and our families safe, our clients safe. So for us to also be able to give guidelines to our clients who might come in and say, you know, what does it mean flattening the curve? I see all this out there. What does that mean? Can you give us some terminology, or at least a way to explain easily to a client why it's so important that we are restricting our number of clients coming into our practices, even though they might think coming in for that food refill today necessarily needs to happen and we want them to stay in their car? What can we educate them on in regards to flattening the curve?
So the concept here is that if we let an infectious disease run its course by itself without doing anything, without doing the normal things that we do, we will see a lot of infectious cases occurring very, very quickly. So in other words, with something like COVID-19, the estimate is that for every one individual that is infected and goes into a group of individuals that are susceptible or able to be infected, at least 2 to 3 individuals will now become infected. And so if we think about, as we think about things multiplying, whether those are E. coli or various other things, we will recognize that very, very fast this curve grows very, very quickly. And it grows so fast that what it ends up doing is it really ends up causing a huge burden on public health and the health system. So whether we're talking about individuals that are working in healthcare, we're talking about healthcare beds, we're talking about availability of these things, but also just general day-to-day activities, right? So people that are available to run the gas station and to get our food together. So it's important that we try and slow the movement of something like this virus through our community. And a way that these viruses are transmitted and what makes them infectious is how long they stay infectious. Well, we don't have a lot that we can do about that. The number, basically how likely it is that if you come into contact that someone will become infected, we don't have a lot of opportunities to alter that. But what we can alter is how many contacts in general we have, right? And so that virus is gonna explode or go much, much faster through a population if there's a lot of contacts. For instance, if I'm just allowing myself to see a lot of individuals and I'm infected, versus if I can control the number of individuals that I see. And that's that concept of social distancing, right? And so with that social distancing, we reduce the number of people that each individual is potentially having contact with, and we dramatically reduce the speed at which this virus moves through the population.
That's wonderful advice. So as we move every day through this unprecedented time, as veterinarians, what can we learn from this so far outside of the social distancing? And what can we be doing as healthcare professionals, both within our practice, but also just in the world, to really help do what we can to make this pandemic slow down as quickly as possible?
So, I mean, I think the first thing is just being aware of information that's coming out. We're being asked as veterinarians, many of us already have, to kind of contribute in our own ways. So sometimes that means contributing our supplies to human healthcare. At some point, it could be knowledge, it could be various other things, but certainly staying up to date with a constantly changing, what is happening in our day-to-day practices and what public health is necessarily recommending. So I think that's part of it is being in tune with what's going on. In terms of I think takeaways as well, part of it is this interconnection, right? And so if we think about where did this virus originate from? There's no concrete evidence, but certainly extremely suggestive that it originated in animals. And again, there's this connection, this One Health connection about understanding how viruses are moved and diseases in general move in populations of animals, and that also helps us to interpret and to deal with these diseases that can potentially transmit between animals and people. And then I think finally is really making us really evaluate our infection control and our kind of general emergency preparedness plans. This is a really good time to be thinking a little bit about what are the things that are going well, what are the things that I wish that I had planned for. So some easy stuff like infection control in terms of how are we able to screen for our clients when they're coming in the door to ensure that they're healthy and safe for our contacts. But also our daily cleaning activities, how effective are they? Are there ways to measure that? And then from an emergency preparedness, what stocks do we have? Are the things that we should be ensuring that we always are keeping available to us? Because today we're talking about a disease that primarily is occurring between people. Very, very possible at some other point we could be dealing with things that are much more in our wheelhouse in terms of dealing directly with the veterinary population. So I think this hopefully is a good lesson for us in terms of some of this preparedness and some of these things that we can make changes today.
And lastly, because we've got to go, I know we could talk for hours on this, and I know you've got a lot to do as well, but what is a good resource? You're talking about staying up to date on information. Where would you be sending veterinarians and their teams for the most accurate and up-to-date information?
So there's a couple of great places, and I suspect many are already going to some of these places. The AVMA is really trying to do a great job of keeping up to date on kind of consistent messaging. I think that's important. That's a great place to send your clients if they're looking for something, they have questions. The Centers for Disease Control and Prevention has their own page that's actually now dedicated to animals and COVID-19. So great place to, again, get those consistent messages. For your kind of local activities, and again, that's going to be really important because what we're doing, for instance, in one state may be very, very different than what we're doing in another, is just trying to be aware of, either if you are aware of your public health veterinarian that's in your area, or other type of messaging on public health websites in your area, so that, again, we are part of the solution and can be part of the ability to help educate our clients and those around us. And remember, everyone, so I know that people are getting to the point where potentially we're closing practices, we're reducing hours. We're going to get to the other end of this, and that's a really good thing. But as we do, that also means that we need to begin to kind of loosen up on some of those pieces. We're opening practices up again, and we need to be aware of what are the precautions that we can take so that we can do so in a safe way.
Well, Dr. Stull, thank you so much for your leadership, your knowledge, and your time today. And I hope we can catch up in a few weeks, maybe, we hope, with a much more positive and hopefully end of the tunnel light that we might be seeing to this pandemic. We appreciate all you do. Thank you again.
Anytime. Appreciate it.